Good morning, it's Mary Dacey. I have been absent a bit. When I started this, I had mentioned I had felt a renewed energy this summer and I was able to get a lot done. But as fall is coming in, I am losing the energy and reverting back to many of my regular daily symptoms, such as swollen, painful fingers, fatigue. But we had gone through all of the things as far as stress goes in my life that I attributed to a diagnosis. And we started with the first one, which is fibromyalgia. And I just finished that one the last time I was posting. So today I want to go over a lot of different subjects. And the reason for this is that a lot of autoimmune symptoms cross over from diagnosis to diagnosis. And there are just two that I want to address today. One is cognitive, and I think I had mentioned before also that I had been telling people for years I had Alzheimer's. But here are some of the crossover cognitive issues that I personally have that cross over to everything that I've been diagnosed with. Confusion, difficulty expressing ideas in words, following conversations, making decisions, moving my mouth to speak, putting ideas together to form a complete picture. Recognizing faces is getting worse for me. Names of objects, names of people. Long-term memory and short-term memory. Easily distracted from a task, impaired ability to concentrate, losing track in the middle of a task, or in the train of a thought, or in the middle of a sentence. This has been happening regularly for years. Trouble concentrating, using the wrong word, and word finding difficulty. So that is just some of the things that were brought up in fibromyalgia the first time, in the first autoimmune disorder. And then I also had brought up MTHFR, and I said I would get into it further later. And I explained that it basically is a mutation of a gene, and that if you have this, it causes all kind of issues because you're not absorbing B vitamins and things that you really must have to function. So I wanted to go over one of the things you wind up with a B12 deficiency. anemia, but specifically pernicious anemia. And some of the common overlooked symptoms are weakness, headaches, chest pain, weight loss. It also causes, in some cases, like myself, neurological symptoms, which include unsteady gait, spasticity, peripheral neuropathy, progressive lesions of the spinal cord, memory loss. It can also include nausea and vomiting, confusion, depression, constipation, loss of appetite. And all of these, if you have the specific gene mutation for MTHFR, your body is not absorbing B vitamins. And so over time, years, these symptoms that you are developing and being diagnosed with autoimmune deficiencies may go all the way back to your body never having the proper tools it needs to absorb the vitamins and minerals your body needs to function. There's a type of protein called intrinsic factor, IF, and that is used to absorb vitamin B. It's in the stomach lining, and then it's absorbed in your small intestine. In pernicious anemia, the body's immune system attacks and destroys the cells that produce IF. And the body can't make IF, and then it can't develop vitamin B or absorb vitamin B. And eventually, without enough, your body will produce abnormally large red blood cells, and they lead to fatigue and weakness. Certain medications and antibiotics, long-term use also can lead to pernicious anemia. Pernicious anemia is another autoimmune disorder. And the risk factors include having a family history of the disease, being of Northern European or Scandinavian descent, having diabetes, Crohn's disease, having part of your stomach or intestines removed, being 60 years or older, being strictly vegetarian. Treatment usually comes with injections of vitamin B12, which you give yourself. They can be daily, weekly, and then you have tests to see where your levels are at. But if you've been living with this for a very long time, you may have other complications, which include nerve damage, digestive tract problems, memory problems, confusion, other neurological symptoms, and heart damage. And all of them often come from long-lasting pernicious anemia. And the ones that I just listed are also symptoms that I have had: nerve damage, digestive tract, memory, confusion, neurological, and heart damage. There's a lot more that goes into this, but they're just two of the things I wanted to address today as we go into autoimmune issues and living with the effects that they have on your body. And I will come back tomorrow, hopefully, if I do not have another day like yesterday where I spent from 4 in the afternoon till midnight in the ER. So that is why I decided to do this in the morning, because I don't know how long I can stay up today. So hopefully I've reached someone who needs this information, or someone who can pass it along to someone who needs it. And again, if you join the Smart Patients Network and look up any of the topics such as pernicious anemia or vitamin B deficiency or just fibromyalgia, there's so much information out there. And then you can go into other groups, different websites, and find even more information. And you need to be your own researcher always. And don't stop with the diagnosis, because it will usually evolve into another diagnosis with more symptoms. So have a good day, and I hope to be back to talk with you tomorrow. Bye-bye.